Hello, and welcome to the Chest Journal's Editor Highlights podcast. Each month, Chest Editor-in-Chief Dr. Peter Mazzone highlights key articles from the current issue of the journal to help clinicians stay informed about new research in the fields of pulmonary, critical care, and sleep medicine. To introduce this month's episode, here is Dr. Peter Mazzone.
Thank you for tuning in to the Editor's Highlight podcast for the March 2025 issue of the journal Chest. We have a great lineup of diverse content in this month's issue. Over the next 15 minutes or so, I'll provide a brief overview of key manuscripts published in each of our content areas. First will be our asthma content area. Guidelines recommend standard clinical practice activities such as asthma reviews, asthma management plans, and inhaler technique checks to minimize asthma exacerbation risk in children. Compliance with these recommendations in practice and their effectiveness are unclear. In this issue, Zoloff and colleagues report findings from a retrospective chart review of United Kingdom primary care and hospital records from over 126,000 children, designed to determine if guideline-recommended activities can prevent asthma exacerbations. 30 to 45% of patients received each of the three annual activities, with 8% receiving all three together. Younger age, socioeconomic deprivation, and higher BMI were associated with not receiving these activities. Management plans and asthma reviews were each associated with an approximately 15% exacerbation reduction over 12 months. Provision of all three activities together was associated with an approximately 30% exacerbation reduction over 12 months. These findings suggest that most children in the UK do not receive guideline-recommended activities to monitor their asthma, and that when they are implemented, they are effective in reducing exacerbations in clinical practice. Next is our chest infections content area. There is limited information about the rate and impact of isolation of genetically different strains within the same species of Mycobacterium avium complex in patients undergoing treatment. In this issue, Lee and colleagues used multi-locus sequence typing genotypic analysis of serially collected pre-treatment and on-treatment clinical isolates to evaluate the frequency of genetically distinct strains within the same species at different clinical time points. 198 of 327 enrolled patients had on-treatment isolates of the same species as the pre-treatment isolates identified. Of these patients, a genetically different strain was identified in 24.7% of the patients on treatment isolates. These findings suggest that approximately a quarter of patients in whom the same species of MAC is identified on treatment have a genetically distinct strain, which could impact the determination of treatment outcomes and treatment strategies. Also in this section is a research letter that evaluates the outcomes of patients with spontaneous bacterial empyema who are given albumin, and a How I Do It review of the presentation, diagnosis, and treatment of parasitic infections in pulmonary and intensive care unit patients. Our COPD content area is next. The clinical and prognostic characteristics of mild to moderate COPD with and without emphysema are unclear. In this issue, Yang and colleagues report findings from 989 participants of the Spiromics study with mild to moderate COPD, 43.3% of whom had emphysema on CT scans, designed to determine if clinical and prognostic characteristics differ between mild to moderate COPD with and without emphysema. In this cohort, the annual decline in FEV1 did not differ between groups, whereas the rate of emphysema progression was higher in those without emphysema at baseline. The group with emphysema at baseline had a larger annual increase in the St. George's Respiratory Questionnaire score and a higher rate of acute respiratory exacerbations. These findings identify an association between the presence of emphysema in those with mild to moderate COPD and worse health-related quality of life and a higher rate of acute respiratory exacerbations. 3 other original research manuscripts appear in this section. The first compares the MMRC and CAT scores with CPET to identify abnormal exertional breathlessness in COPD. The next compares the safety of single inhaler triple therapy to LABA ICS therapy in COPD patients in real-world clinical practice. And the final evaluates peak inspiratory flow and inhaler prescription strategies in a specialized COPD clinic program. Next is our critical care content area. The impact of oxygenation targets on outcomes of a diverse group of adult patients with COVID-19 and hypoxemia in the ICU is unclear. In this issue, Nielsen and colleagues present a pre-planned Bayesian analysis of the handling oxygenation targets in COVID-19 trial, assessing clinically meaningful outcomes in 697 patients randomized to a target PaO2 of 60 millimeters of mercury or 90 millimeters of mercury. The mean difference in days alive without life support was 5.7 days, with a 95% probability of clinically relevant benefit and 98% probability of any benefit from the lower PaO2 target. The 90-day mortality risk difference was 4.6%, with a 76.5% probability of clinically relevant benefit from the lower target. A potential interaction with baseline norepinephrine dose and lactate concentrations was noted for both outcomes. These findings identify a high probability for a clinically relevant benefit of targeting a PaO2 of 60 millimeters of mercury versus 90 millimeters of mercury on the number of days alive without life support. Also in this section is an original research article that evaluates the impact of perioperative pulmonary artery catheter use on clinical outcomes following cardiac surgery, and a research letter that evaluates the association between caregiver strain and emergency healthcare resource utilization in survivors of critical illness. On to our diffuse lung disease content area. The renin-angiotensin-aldosterone system has been implicated in the pathogenesis of sarcoidosis. The impact of RAS modulators on health outcomes in sarcoidosis is poorly understood. In this issue, Ferris and colleagues report findings from a multi-center research network database designed to determine how pharmacologic modulators of RAS affect health outcomes in patients with sarcoidosis. 4,888 patients using ACE inhibitor therapy and 7,356 using ARB therapy were included, with 4676 in each group after propensity matching. An increased mortality risk was seen in patients prescribed ACE inhibitors compared to those prescribed ARBs, with a hazard ratio of 1.32. They noted increased rates of sepsis, an odds ratio of 1.51, respiratory failure, odds ratio of 1.32, and acute MI with an odds ratio of 1.28. These findings suggest a potential for the type of RAS modulator to impact outcomes in patients with sarcoidosis. Also in this section is a research letter that evaluates the impact of nintedanib dosing on clinical outcomes and a chest review on the diagnosis and management of interstitial lung abnormalities. On to our education and clinical practice content area. Osteogenesis imperfecta is a rare hereditary disease linked to reduced or altered collagen type 1. Pulmonary manifestations of osteogenesis imperfecta have not been well described. In this issue, Anderson and colleagues report findings from a registry-based nationwide cohort study that included all patients with osteogenesis imperfecta in Denmark, total of 862, as well as a reference population of almost 4,300. The study was designed to determine if patients with osteogenesis imperfecta have increased admission rates from pulmonary diseases compared with the general population. The admission rate was noted to be highest in females aged 65 years or older with osteogenesis imperfecta, 56.3 per 1,000 person years, compared to 29.4 in the reference population. The highest admission rate in males with osteogenesis imperfecta was in those aged 0 to 18 years, 30.4 per 1,000 person years, compared to 7.7 in the reference population. Those with osteogenesis imperfecta had a higher proportion of long and short-acting bronchodilator drug use, but did not have an increase in the use of antibiotics. These findings identified low rates of admissions for respiratory disease in those with osteogenesis imperfecta, but higher relative risk compared to the general population. Completing this section is a How I Do It review on the creation of an advanced practice respiratory therapy education program. Our pulmonary vascular content area is next. Pulmonary embolism response teams assist care in adults with life-threatening pulmonary embolism. The feasibility and impact of a PERT program in pediatrics is less clear. In this issue, Dang and colleagues describe a strategy to execution proposal for a pediatric PERT program with outcome tracking to determine its feasibility and whether it improves PE care. The multi-specialty pediatric PERT program took 12 months to implement. Data on 30 patients prior to PERT and 31 post-PERT implementation were analyzed. Post-PERT, there were 13 PERT activations based on PE risk category. Time to echocardiogram, anticoagulation orders, and administration were shorter post-PERT. 5 of 6 eligible patients received reperfusion therapies post-PERT compared to 3 of 8 pre-PERT. These findings suggest a pediatric PERT program is feasible to implement and can facilitate timely advanced therapies. Also in this section is an original research article that evaluates whether graded transthoracic contrast echocardiography after pulmonary AVM embolization can replace chest CT, and a special features review summarizing pulmonary vascular disease fellowship training. On to our sleep medicine content area. Deficits in cognitive function are a troublesome symptom in patients with obstructive sleep apnea and excessive daytime sleepiness. In this issue, Van Dongen and colleagues report findings from a phase 4 randomized, double-blind, placebo-controlled crossover trial designed to determine how solriamfetol affects cognitive function in patients with cognitive impairment associated with OSA and excessive daytime sleepiness. Solriamfetol was found to significantly improve post-dose average digital symbol substitution test and the repeatable battery for the assessment of neuropsychological status scores. Cognitive function was significantly improved at 2, 6, and 8 hours after dosing. There were significant improvements in the British Columbia Cognitive Complaints Inventory, Patient Global Impression of Severity, and Epworth Sleepiness Scale during treatment compared with placebo. These results show that solriamfetol can improve objective and subjective measures of cognitive function in patients with cognitive impairment associated with OSA and excessive daytime sleepiness. Completing this section is a point-counterpoint debate on whether watchful waiting is an appropriate treatment for obstructive sleep apnea in children. Next is our thoracic oncology content area. Shared decision-making with patients considered lung cancer screening may lead to improved patient outcomes. In this issue, Slator and colleagues report findings from a prospective longitudinal repeated measures cohort study of 343 individuals in 3 different health systems, designed to determine which components of high-quality patient-centered communication are associated with decision regret and distress. 59% of respondents reported mild decision regret and 2% moderate or severe regret. 9% reported mild distress and 6% moderate or greater distress. Decision satisfaction scores were 9.8 and 9.1 out of 10 in those with no and mild regret, respectively, and 6.1 in those with moderate or severe regret. Patient-centered communication domains were not associated with decision regret or distress. These findings show that it is uncommon for patients undergoing lung cancer screening to have moderate or greater decision regret and distress. It may be challenging for communication interventions to impact regret and distress. Also in this section is a special features review on the moral imperative for pragmatic clinical trials in interventional pulmonology and a CHEST guideline on the acquisition and handling of endobronchial ultrasound transbronchial needle samples. I encourage you to read our Humanities in Chest Medicine section, where you'll find an original research article on health system purchasing professionals' approaches to considering equity in procurement, and a case-based discussion on end-of-life ethics consults in the ICU that addresses who has the final say, the patient or the family, as well as our commentary series, where you'll find thoughtful pieces about the application of implementation science to pulmonary and critical care medical education in the DOJ decree in the transition from Philips to devices. Finally, please review our case series publications for the month, which provide novel and educational cases to help improve your clinical skills. I hope you enjoy reading all of the high-quality content available in this month's issue of CHEST. As always, I'm grateful to the authors of this work, the reviewers who volunteered their time to improve the quality of these manuscripts, and to our editorial board for guiding everything that we do. Until next month, I hope you enjoy the March issue.
Thanks for listening to the Chest Journal's Editor Highlights podcast. You can find the articles mentioned in this podcast and more on chestjournal.org. And if you're looking for more context and commentary on articles in the current issue, please check out the original Chest Journal podcast, which features in-depth discussions with the authors themselves. We'll be back again with more Editor's Highlights next month.